Welcome to The Explainer. Today, we are cutting straight through the massive mountains of marketing and, honestly, some pretty intense medical debate to answer one major question. What exactly is the G-shot, and how does it actually work? If you've been navigating the wild world of sexual wellness lately, you've definitely seen the ads, right? You've heard the claims. Well, let's strip away all that hype right now and look purely at the clinical reality. But right off the bat, we run into this massive, polarizing question. Does the G-spot actually exist? We honestly can't understand the cosmetic procedure known as the G-shot without first unpacking the decades-old medical controversy surrounding its actual target. I mean, is it a distinct organ? Is it just a myth? Let's figure it out. So here's our roadmap. We'll start with the elusive G-spot explained, define what the G-shot is, cover how the procedure works, compare the G-shot versus the O-shot, and finish up with the evidence, risks, and reality. Let's dive in. All right, Section 1. The elusive G-spot explained. First things first, we've got to totally scrap this myth that the G-spot is just some simple magic button waiting to be pressed. Human anatomy is way more sophisticated than that. When medical professionals and researchers talk about the G-spot today, they're increasingly referring to the clit urethrovaginal or CUV complex. This isn't a single isolated dot. It's a dynamic functional zone located on the anterior or front vaginal wall. It's this highly interconnected region where the internal roots of the clitoris, the urethra, and the femoprostate, which are often called Skene's glands, all interact. It's a whole area rich in nerve endings and erectile tissue, which totally explains why stimulation here can lead to strong arousal for so many women. Now here's where the debate gets super fascinating. Dr. Emanuele Giannini led a study using ultrasound technology. His team actually found that women who reported experiencing vaginal orgasms had noticeably thicker tissue in this specific anterior vaginal wall space. He went as far as suggesting ultrasound could literally confirm the presence of a G-spot. However, it's absolutely crucial to note that other leading sexologists and researchers look at this exact same tissue and argue, no way, there is no separate G-spot at all. Instead, they believe this sensitive area is simply the internal extension of the clitoris. Section 2. What exactly is the G-shot? Let's pivot from biology to the actual commercial cosmetic solution that's been specifically designed to target this exact, highly debated zone. The G-shot, which clinics call G-spot amplification or anterior wall augmentation, is a non-surgical, elective procedure. It involves injecting a dermal filler directly into the submucosal layer of the anterior vaginal wall. And we're talking about cross-linked hyaluronic acid here, which is basically the exact same stuff used in lip or facial fillers. The goal? Simple physics. By creating physical bulk, we're talking about the size of a coin. It projects lower into the vaginal canal. This theoretically makes the area way easier to locate and increases mechanical friction and contact during sexual activity. But here is the massive catch: 4 to 6 months. Because hyaluronic acid is a totally natural substance, your body is gradually going to metabolize and absorb it. That means the physical bulk created by the G-shot and any heightened sensations you might get from that friction are strictly temporary. To maintain the effect, patients literally have to return for repeat injections a few times every single year. Section 3. How the procedure actually works. So if someone decides to pursue this, what does that look like in the clinic? The mechanics are honestly quite straightforward and typically only take about 15 to 30 minutes in an outpatient setting. Step 1 is consultation and mapping. Interestingly, the patient often does a self-examination right there to help the doctor locate the most sensitive spot, which they then measure. Step 2, the patient is positioned just like they would be for a routine pap smear. A specialized speculum is inserted and local anesthesia is applied to numb everything up. Step 3 is the actual injection of that hyaluronic acid filler right into the targeted zone. And finally, Step 4 is just a very short recovery period in the clinic. The downtime here is super minimal. Patients can usually just walk out and get right back to normal activities. But to let that injected filler settle and expand along the anterior wall, there are some hard restrictions. Patients are typically told to avoid sexual intercourse, swimming pools, bathtubs, and tampon use for anywhere from 4 hours to a few days. It really just depends on the specific provider's guidelines, mostly to prevent irritation or a nasty infection. Moving on to Section 4, the G-shot versus the O-shot. If you've spent any time researching sexual wellness procedures, you have undoubtedly seen both of these marketed, usually right next to each other. It is incredibly easy to confuse them, so let's clear that up once and for all. Here is the big difference. The G-shot is an amplification procedure. Like we talked about, it uses hyaluronic acid filler to create a literal physical bump inside the vagina to increase mechanical friction. It does not grow new tissue. The O-shot, on the other hand, is marketed as a rejuvenation procedure. It uses platelet-rich plasma, or PRP, which is spun out from a sample of your own blood. That PRP is then injected into the clitoris and upper vaginal wall. The theoretical goal there is to use stem cells and growth factors to stimulate actual nerve regeneration and blood flow. So two totally different materials, aiming for two completely different physiological mechanisms. Finally, Section 5, Evidence, Risks, and Reality. Look, it is absolutely vital to balance those super confident, enthusiastic claims you see on cosmetic clinic websites with the independent consensus of the broader medical community, because there's a pretty stark juxtaposition between the marketing and the clinical reality. Clinics promise heightened arousal, stronger orgasms, increased sensitivity, and yeah, many clinics cite a pilot study where 87% of women reported enhanced gratification. But the clinical reality? This procedure severely lacks robust, independent, randomized controlled trials. There is just no large-scale, peer-reviewed scientific consensus proving that increasing tissue volume actually translates to improved sexual satisfaction. The mechanism is purely physical friction, and at the end of the day, it remains an elective, experimental cosmetic procedure. To really hit this nail on the head, check out this quote from Dr. Farzana. Major, leading medical and regulatory bodies, we're talking the NHS, NICE, and the Royal College of Obstetricians and Gynecologists, do not endorse these branded sexual procedures. In fact, injecting fillers into the vaginal wall is considered an off-label use of those products. It's so important to understand that the medical establishment approaches these interventions with high caution. Informed consent and realistic expectations are absolutely essential here. Since the shot only takes like 20 minutes, it's super easy to view it as just a simple, quick cosmetic fix, but it carries real clinical risks. Patients might experience minor pain, swelling, or bruising, but more significant risks include infection, the possibility of the filler actually migrating from the injection site, dyspareunia, which is painful sex, and even urinary retention issues or UTIs, just given how close the injection is to the urethra. Which brings us to the financial reality, $1,000 to $2,500 out of pocket per treatment. And remember how we said the body naturally dissolves the filler? Yeah, that means you're paying this every 4 to 6 months if you want to maintain the effect. Because this is strictly an elective cosmetic procedure, it is never covered by medical insurance. It represents a significant ongoing financial investment for something with temporary results and limited clinical evidence. Which leaves us with this final, honestly, pretty profound question to consider. Is sexual satisfaction purely anatomical, or is it something way more complex? The G-shot attempts to solve the puzzle of sexual pleasure by basically just adding physical volume to a specific piece of tissue. But human sexuality is incredibly fascinating. It deeply intertwines our neurology, our vascular system, our hormones, and our psychology. Can a temporary, localized cosmetic injection truly address all of that? It's a fascinating debate bridging anatomy and the human experience. Thank you so much for joining me for this explainer. I hope it gave you the clear, structured insights you were looking for. Until next time, keep learning and stay curious.